Hello friends, I am Dr. Sadeep, homeopathy consultant. In our channel, we will be dealing with these homeopathic subjects: organon of medicine, philosophy of homeopathy, materiamedica, and basics of all homeopathic principles, and how to apply these principles in the practice to become more successful and achieve the goal of homeopathic cures. So if you are interested in these subjects, please subscribe our channel and be a part of our group. So if you have any doubts, you can put in the comment section. I will try to answer those questions. So today's subject is, friends, Gelsemium. So this in Materiamedica we usually study Gelsemium. This is one of the acute medicines. So I will tell this how the Gelsemium patient look like. What is the picture of Gelsemium? So Gelsemium, if you come to the common name, it's a jasmine, yellow jasmine, and it belongs to the family. It belongs to the plant kingdom and the family Leguminosae, and also it has a common name as heartbreak grass. So this is also one of the common name of Gelsemium. So if you come to the Gelsemium, what are the causation factors in Gelsemium? So in Gelsemium, one of the thing is emotionally and mentally, this patient will be disturbed. The cause will be the emotions or the anger, fear, sudden bad news, and he is very sensitive to the sun heat. So this is one of the medicine which is used in the summers. So another thing which is in the causative is self-abuse. Whenever the person abuses himself in the mind, body, and his emotional aspect, this is the medicine indicated. And in this medicine, anticipation is strong. He wants to be alone. So these are all the causative factors of this Gelsemium patient. Once if you understand these causations, then we can go to the understanding of the miasm. This comes under psychotic miasm. So psychotic miasm is the miasm which takes the hold of this economy. Now if you talk about the pace of this medicine, this is an acute medicine we consider in this acute medicine, but the pace is a little bit moderate, like bryonia. So the symptoms appear like gradually. So gradually in the means like symptoms will totally present in 24 to 48 hours of the affection. It is not like aconite, belladonna, stramonium. It's not like that. It is a little moderate pace medicine. So by considering the pace, you can come to know this how the medicine acts. But this is also a deep acting medicine. It acts till the level of the heart. So this is about the pace of this Gelsemium. So if you come to the very characteristic symptoms of this Gelsemium, so nervous system is the main system which is involved in this medicine. That too, motor nerve fibers are totally exhausted or totally paralyzed. Due to this reason, the patient has an incoordination in his mind, in his body, and in his emotions. So due to that reason, you can see a keynote prescription or a keynote symptom, that incoordination of the muscles. So this is the mind symptom which is traveled to the body. So this is one of the mind symptoms of the Gelsemium. Another very marked mind symptom of the Gelsemium is fear of falling. So he has a very drastic fear of falling. Due to that reason, he will be always grasping to the side by object or to the person nearby. And keynote symptom has also given one very important mind symptom in these keynotes, that is child grasps to the nurse or the mother or the clings to the nearby furniture. So this is because of the mind fear of falling. And another one with this, the associated thing is chills. This medicine has a nervous chills without thirst. So this you must note it very properly. Whenever there is chills, there will be thirst in common conditions. But in this Gelsemium, chills without thirst is one of the very key note of this medicine. And the medicine has a chills of very drastic nature. The trembling of this, very much trembling is there in this Gelsemium, friends. So if you consider this trembling as a main symptoms, it is one of the very characteristic symptom of Gelsemium, trembling. So hands will be trembling and even tongue will be trembling. So tongue will be trembling and total body will be shaking. So this is one of the very characteristic of Gelsemium patient. If you go to the patient near and examine his body, there nervous debility will be there, trembling will be there from head to foot. So he is not in a position to be in a steady state. So he will be trembling from head to foot. Even if you ask to open his mouth and show the tongue will be trembling. So trembling is one of the very important symptom of this Gelsemium, friends. So I just made it included in this mind category. And another one very important symptom of this Gelsemium is wants to hold the body. So the Gelsemium patient wants somebody to hold his body because of two reasons. One is he has a fear, and another is the total paralysis of the motor nervous system make him the body trembling. These two reasons wants him to be held in a position. So this is because of that reason he wants somebody to hold the body. And chills are very nervous, as I told you. Accompanied with trembling, he has a confusion in his mind. Dullness of the sensorium is much observed. This is not the sensorium dullness as in the Baptisiae. So Baptisiae has a very much higher grade of sensorium loss. Here it is little lesser than that Baptisia medicine, that is sensorium loss. So the Baptisia patient talks and telling the symptoms he goes to sleep. Here also the same feature will be observed, but it is in a lesser intensity. So patient is dull, his face is red, and he will be very drowsy. So same symptoms are being observed in Baptisia also. There are many other features of Baptisia which can differentiate from Gelsemium. So in Baptisia, if you consider, there is a very smell will be there. That is offensiveness of Baptisia is differentiation symptom of this Baptisia from the Gelsemium. So intensity of this dullness, drowsiness is being observed in this Gelsemium. So if you go and find out his intellect, so it is totally anticipating. There is loss of confidence in his self. So this loss of confidence gives him a fear of stage. Stage fear, stranger fear is one of the very important symptom of this Gelsemium. And in company wise, he does not want any company, he does not want anybody near him. So this is one of the mind state or the mind symptom of the Gelsemium. In spite of his so much of suffering, in spite of his so much of fear, in spite of his so much of trembling, chills and so many symptoms, he does not want anybody near him. That is one of the very important feature of Gelsemium. And another very important feature of Gelsemium is he wants to be still. So total body has a trembling sensation. His mind is dull, he is drowsy, and he wants to be still. The body is very much heavy. So this is one of the very much important symptom in Gelsemium. Due to that reason, his eyelids are very much heavy and he will be closing his eyes all the time because eyelids are very much heavy. And total body is like a log. So he is feeling that heaviness in all the part of his body. And a motor nervous paralysis of the body has occurred. Due to that reason, he is unable to move from one place to another place. This is not the aggravation of the bryonia, which is aggravated by movement. It is very different from this bryonia. Here, he does not want to move from place to place because of this heaviness, not because of the aggravation from movement. So this is a very minute thing you must note in Gelsemium. So these are all the characteristic features, mental features of Gelsemium. And if you go to the PQRS symptoms of Gelsemium, there are 3 to 4 organs which are very particularly affected in this Gelsemium. One of that is head. So in head, you will observe very much characteristic symptoms. There are 3 characteristic symptoms in the head. So as you know, the Gelsemium patient has headache, which is located in the occiput of the region. Occipital headache will be there, which is relieved by keeping the pillows. So he wants the head in a high position. If he does not have a pillow, he is aggravated. This is very peculiar symptom of the Gelsemium. In headache, he will be having blindness. So prior to headache, he will be having blindness. When headache appears, he will be relieved by this blindness. This is one of the very characteristic symptom of this Gelsemium. So another one important symptom of Gelsemium in headache is he is relieved by profuse urination. That is, headache is relieved by profuse urination. So these are the 3 very characteristic symptoms of headache. And in chills, it is very characteristic. These chills are running from scapula to the occipital region. This is very characteristic chills, nervous chills of this Gelsemium. And these chills are not relieved immediately. It will go on producing the chills in the wave form. And this is very much associated with the trembling. So we can call it as rigors also in a common terms. If you tell rigors, chills and rigors is observed in Gelsemium. And chills without thirst is one of the very characteristic symptoms of this Gelsemium. So this is the second very characteristic PQRS symptoms of Gelsemium. And thirdly, if you come to the child, so if you come to the child has a very marked fear of falling. This is very characteristic in the child. It is not that fear of borax. Borax has a fear of falling whenever there is a downward motion. But in this Gelsemium, it is marked fear without any motion. No downward motion, no upward motion. In spite of that, the child will be grasping the mother, child or a furniture, and the fear is very much of falling. So this is one of the very characteristic symptom of Gelsemium. Another character of Gelsemium is related to heart. So as the common name, as I told you, heart break grass. So it affects the heart of the body. In heart, the patient or the Gelsemium person has a very peculiar symptoms. In the keynote, he has given that until and unless he moves, the heart will stop. Whenever he moves, the acceleration of the pulse is observed in the Gelsemium patient. He will subjectively feel that pulse increases, heart rate increases, and he will give a symptom that my heart is beating more, doctor, whenever I start to move. So this is one of the very characteristic symptom of this Gelsemium. So in Gelsemium, there is a mental state wherein whenever he thinks of any symptoms, the symptoms are aggravated. This is one of the very characteristic symptom of Gelsemium. And if you come to the aggravation amelioration factors, one is he is aggravated in both warm and cold. He is aggravated by any emotional upset. He is aggravated by any bad news. He is aggravated by thunderstorm. He is aggravated by slightest changes in the environment. This is also aggravated in the summers. Sun heat, one of the important feature is he is aggravated by sun heat. So these are all about this aggravation factors. And another one important amelioration factor is he is totally ameliorated with profuse urination. He is aggravated by tobacco smoking, and he is aggravated by telling anything about his own loss. So these are all the aggravation and amelioration factors in Gelsemium. So I have totally touched the all features in Gelsemium, wherein a clear picture of the Gelsemium you will be getting into your mind. So one of the trick of learning homeopathy is just read the picture form of the remedies, and with that you must also be in a position to relate the mind symptom to the body symptoms. This is one of the important feature to learn homeopathy. So this is all about today's session, friends. If you feel helpful by this video, please send this video to your friends, colleagues, and homeopathic doctors and homeopathic friends, homeopathic circle. So this will help them to understand Gelsemium. Whenever Gelsemium is required, if you give Gelsemium, there will be a miraculous cure of the patient. Thank you one and all.